Y'all, they say the system works for the people, but what actually happens when these very people are left behind? And while the powerful, well, they profit, I'm about to expose the lies and the fraud and why the one big beautiful bill works in now we the people's favor. Okay, shout out to Trump for that. Now, and I'm gonna also shout out Christy Nome for being able to allow ICE agents now to dig into that Medicaid data. Not only will they be getting the names of these very illegals, but they're also have access to addresses and such. Let's go ahead and clean house if you ask me, because there's no such thing that should be taking place while we the people work and provide these tax dollars for these very illegals should be denied no type of Medicaid or anything above. This should have been already given to us. So with that being said, y'all, we're about to dive into a young lady who actually takes her platform and exposes and actually shows you how many people, that is, the citizens of the United States, are denied, while illegals sit here and get it free. No more. Shout out to Trump and his administration for that one big beautiful bill that is taking place. Let's dive into the first clip, y'all, coming straight from Wall Street Apes on X. If y'all would like to follow this guy, American healthcare worker films herself on the phone with United Healthcare to show everyone how impossible it is to care for patients. Let's not waste any more time, y'all. Let's dive straight into the video. Let's go.
This is absolutely insane. Do you understand? I've been on the phone for an hour now, getting sent every which way, and this patient's had an approval for over a month, but hasn't been able to try to even sign up for the assistance to get her medication. You understand, but what's the resolution? Just sending me to another department where it's offshore and I have to ask for someone onshore? Like, this is absolutely insane. You would think you guys would be worried about public relations with how your guys' media is going right now. Like, seriously? Can I speak to a supervisor? I don't want to be sent anywhere else. I need to speak to somebody that has access to multiple areas at your company. This is so dumb. I need a supervisor. Yeah, I'll just talk to a supervisor. Nope, it's been an hour already. Nothing better to do. This is absolutely insane. Do you understand? I've been on the phone for an hour now.
She is clearly frustrated, y'all, due to the fact that a patient is still waiting on a medication, okay, over a month. Yet instead of United Healthcare providing the services, they deny it. It has been set up to delay, deny, and profit. Okay? Crazy, right? But illegals get this type of stuff free. Freely. Given to them. Okay, y'all. We finna dive into some more. Let's get into some more, y'all. I'm going to get into this, and I want you guys to hear his story coming straight from News Doge. That's at Doge_news on X if y'all like to follow this person. This guy was a Democrat until this happened. Listen to this guy's story. Let's get into it, y'all.
This was the precise moment I no longer was a Democrat.
Raise your hand if your government plan would provide coverage for undocumented immigrants.
Okay. That was the precise moment that I knew I was leaving the Democratic Party. Because I was a 2-time bone cancer survivor. I voted for Obama-Biden based on Obamacare. And when it was implemented in 2010, I ended up losing my insurance. Wow. I went from an insurance plan that was $185 a month with a $1,000 deductible to that policy being canceled because it no longer met the requirements of Obamacare. And I was left with the cheapest option being $1,200 a month, $6,000 deductible.
Catch this.
$185 a month, $1,000 deductible to $1,200 a month, $6,000 deductible. Whew. I went 10 years without insurance, and I was penalized each year because I could no longer afford insurance. And in 2016, every single Democrat candidate up on that debate stage raised their hand and said they would give illegals free health care. While me, as a 2-time bone cancer survivor, lost mine. Didn't have insurance for 10 years, and I was supposed to get CT scans, chest x-rays, and all these other tests done every 6 months to ensure my cancer didn't come. And they wanted to give illegals free health.
Crazy.
That was the exact moment I was no longer a Democrat.
Y'all, crazy. 2-time cancer survivor, y'all. Denied. No insurance for 10 years. Meanwhile, these illegals is getting Medicaid left to right with no problem. This was his breaking point. Millions and millions are now starting to wake up and feeling betrayed, y'all, as they should. We the people should. We should. Let's keep this thing moving. Okay, come on. We ain't playing with y'all. Check this out. Now, this has got to be the most sickening, saddening thing that could ever happen, y'all. This is pertaining autism children. Scandals. And I'm so glad that this bill got passed, because now it's going to crack down into all of these scandals that have been taking place since the past administration has had office. Shout out to Trump again. Let's crack down on it, y'all. Coming straight from Liz to TikTok on X. Scandal alert. 85 autism centers in Minnesota caught in massive Medicaid fraud probe. Wow. Let's dive into the video.
Take a look at this graph showing the explosion in this program. This is the amount of money the state has paid in Medicaid claims to autism treatment providers using your tax dollars. You can see in 2017, not that much, just more than $1 million. But you see the gradual growth here. In 2021, more than $80 million. But look at last year, more than $220 million paid out in claims, with a grand total of just shy of $700 million. This is what state investigators are now looking at, these soaring costs, and questioning how many providers are doing real work. Take a look at
they
this
need
graph
to crack down on every last one of these. 1 in the 5, y'all, are being investigated for scandal. This is crazy. And now taxpayers wonder how deep the corruption goes. Oh, it goes deep, baby. It goes really, really deep. But Trump and his administration, y'all, they finna dive right into this BS, because this is just ridiculous. With that being said, y'all, I present to y'all Chris Nomi passed a law that ICE agents now can goddamn dig into the Medicaid data to see exactly who these illegals are getting the Medicaid addresses and all. So with that being said, y'all, let's go ahead and dive into Midwest Miniel on X. That's Miniel Verse on X if y'all want to follow this person. Looks like Democrats run states like Illinois, who handed out Medicaid to illegal aliens, didn't think ICE would be the ones cashing in. Let's dive into the video, y'all. Let's go. Crack down on these bimbos.
Federal immigration and customs enforcement officials are being given access to the personal data of those enrolled in Medicaid. Investigative reporter Mark Rivera is live in the newsroom. And Mark, this will impact more than just undocumented immigrants.
It will, as the I-Team learning today. This information will include home addresses and ethnicities, giving ICE officials the ability to find, quote, the location of aliens across the country. According to the agreement signed Monday between the Centers for Medicare and Medicaid Services and the Department of Homeland Security.
Federal immigration and customs enforcement officials are being
not
given
only does this allow them to crack in on that data, y'all, this actually allows them to deport these same bimbos that was getting these Medicaid for these illegals and things like that. These folks need to be held accountable, because ain't no way that anyone in the United States of America who is actually a citizen here is being delayed and denied Medicaid when these bimbos clearly is giving it out for free off of our hard work tax dollars. Can you think about that and make that make sense? We cannot. Not the common sense world. This is ridiculous. Shout out to Trump again and his administration for passing that one big, beautiful bill. Let's keep cracking down on these folks. Let's go, y'all. Oh, I ain't done. Let's dive into it. Coming straight from the Patriotosis on X, if y'all would like to follow this person, Dr. Oz explains the new requirements to be eligible for Medicaid in the one big beautiful bill that is baby. Let's dive into the news.
We actually fixed the fraud, waste, and abuse, specifically work requirements, which is what they're talking about. When the program was created 60 years ago, it never dawned on anyone that you would take able-bodied individuals who could work and put them on Medicaid. Today, the average able-bodied person on Medicaid, it doesn't work, they watch 6.1 hours of television or just hang out. That's not fair.
It's not okay.
No, go out and try to get a job. They argue that we can't do it. They're arguing against the competency of the American people and their government. I would make the argument that if I offer you a deal, I'll give you free health insurance, but you got to get off your tail and go try to go to work, you'll take the deal. Most Americans have already done that, and they will continue to do that.
Dr. Oz, you have 80 hours a month volunteering school or job training for ages up to 64, able-bodied, twice yearly eligibility reviews. You want to make sure that you're still eligible. So you check in once or twice a year to make sure you're still doing it. No work requirements for people who are pregnant, caregivers for children under 13, disabled, or seniors. But some of the quotes are just unbelievable. You will kill, to Larry Summers, you're going to kill 100,000 Americans. This is the most significant cut to social safety net in American history.
We already have pilots going in 2 states to prove that on your phone, 91% of people on Medicaid have a smartphone. You can just quickly point out where you're trying to work, what you've already done, where you volunteered, what kind of education you've gotten. We are attacking the $14 billion stolen from the American taxpayer because people don't tell you where they work and what they're doing, so they sign up for Medicaid in multiple states. And by the way, what we really wanted to do was to align the president with the governors. If we're creating a social safety net for the country, they have to be working together. The current system encourages governors to game the system. Don't tell anybody that you've got extra people on the roll who actually live in a different state.
And why? Because it's not state money. It is federal money. It's not my money anyway.
And then you have things like illegal immigration coming in. California takes money, pays for illegal immigrants, and then people in Mississippi and Virginia are paying extra federal taxes to compensate for that. We're saying, no, you're done with that. No illegal immigrants. We're not going to pay for gender care. We're not going to do all the things that we believe are undermine the very core deal you have with the states.
But I just think it's important for you guys to get your message out now.
Facts. Okay, so this is for the citizens of America and legal immigrants, not illegals. We are no longer paying for y'all. Get out of here or figure that ish out. You're on your own. Straight up. Ain't no way we should be paying for these folks and half of us be sitting here waiting on lists and trying and getting denied left to right and stuff like that. And the people need it here. It don't make sense. With that being said, y'all, we finna dive into the last video of the day. I appreciate y'all for tuning in, kicking it with your girl. This is coming straight from the Democratic Wins Media on X. I'm glad the One Big Beautiful Bill has been signed, okay? Because, again, Trump is allowing a lot more jobs. If you can work. You're going to have to, regardless of the situation. If you can breathe, you can move around, you're going to have to get a job. Put them 80 hours in so that you can continue to keep your Medicaid if you really want it. Or just deal with the consequences. Straight up. I'm glad ICE got access now to get the dig in these people's data to go ahead and do what they need to do to get these folks on up out of here and get them off of it. Because we the people are tired. We've been tired. And right is right and wrong is wrong. So with that being said, y'all, we're going to go ahead and dive into it. Breaking Democratic Rep. Tom Southy, I got it, went on Fox News and left the host speechless in regard to Donald Trump's cutting Medicaid. Let's dive into the clip, y'all, and I'm definitely going to see y'all in the next one. What are y'all thoughts on this? I want to know. Let's get into the video, y'all. Let's go.
Interruption. You've made Doge a main target, right? You've got that in the crosshair. Medicaid is the next target on behalf of Democrats. There are 80 million Americans who receive some measure of Medicaid reimbursement to a tune of $600 billion. Ooh. Can you not admit that there's got to be some waste, fraud, and abuse?
There's no question.
There's $600 billion.
There's waste, fraud, and abuse throughout government. There's no question about that, and we have to go after waste, fraud, and abuse. But let's recognize that 2/3 of the people in nursing homes are paid for with Medicaid. 1/10 of the veterans in the United States of America are on Medicaid. There are 70 million Americans on Medicaid. It's not just low-income people who don't have any other resources. It's not just disabled people who are really have no other opportunities. It's not just people getting the Affordable Care Act help with health insurance. It's veterans. It's senior citizens.
But you
children.
can see that there is room to trim in that area.
Yeah, but what we're seeing from DOGE, what we've been seeing so far, a lot of it's just been reckless. Why do you want to eliminate people who work to oversee the nuclear stockpile?
They are eliminating the illegal criminals. Illegal criminals, or anybody that is on Medicaid that is not supposed to be on Medicaid. That's where the hell they cutting and trimming down at. Get it right.
Why do you want to get rid of people who oversee the avian flu? Why do you want to get rid of people who oversee measles outbreak in Texas and in New Mexico?
But they brought them back. I mean, I see your point.
But there's a lot of these instances, and I've been involved in government before where I've reduced the size of the workforce when I was Nassau County Executive by 15 to 20%. You have to have a plan. It can't just be reckless and just cut.
They got a plan
as to how you're going to still deliver the important services.
So there's agreement that something should be done. Just a question on how to do it from your perspective.